Hello medicos, are you also a FMGE aspirant? Then Academically has brought to you an amazing opportunity. Yes, kitne pani mein hai aap? How much competition you have in the market? Want to analyze? You all know that the FMG Foreign Medical Graduate Examination mock tests are quite expensive. At Academically, we provide you those mock tests for free. Absolutely. You can give those mock tests, and those are curated by many of the faculties with us who have themselves qualified the FMG, and we had a lot of different resources from which we have curated the content. So, sir, as an FMG aspirant, my paraclinical, preclinical, clinical, which part should be great? All of it. Whether it's your clinical, paraclinical, preclinical, postclinical, everything must be clear right from your forensic medicine involving thanatology, toxicology, pharmacokinetics, to your anatomy, physiology, pathophysiology, biochemistry. You should know the basic radiological analysis, screening like CD scan, MRI, ultrasound, okay? Basic information about endoscopy if they give you certain results, biomarkers, laboratory diagnostic values, suppose LFT, liver function, kidney function, cardiac function, thyroid function, hematology, any other testing methods, or if they give you any particular case, clinical scenarios, because over here we all know that the FMG examination is quite critical. It's in 2 sessions, and let's see that the FMG examination helps you to, you know, have a real time examination pattern or a real time environment of how FMG examination is actually conducted. So it is also known as the Medical Council of India screening test, whereby if you're a foreign graduate, if you've completed your MBBS degree, BDS or anything from abroad, Russia, Bangladesh, any abroad country, Ukraine, and if you wish to migrate back to India, practice in India, then the FMGE test is very, very important. So January 17 is the expected date for this FMGE. Yes, total there are 300 MCQs of 2 sessions, so 150 MCQs in each session. Yes, you get a passing mark of 150 out of 300. What's the first thing that comes to the mind? That's it, just half. But getting that half is very, very important because you have to read through a lot of subjects, right? So that is very, very important. So FMG, who can appear? Obviously, if you have an MBBS degree or equivalent graduate degree in the medicine, you can, and you're not required to appear for the FMG if your degree is from Canada, Australia, US, UK, or New Zealand. This is an exemption because automatically their degrees are recognized in India. But in countries like Russia, Ukraine, Bangladesh, if you have the degree from those countries, you are supposed to sit for this. So as you all know that the November, the application window for FMGE was out. The edit window was in the first week of December, and now the admit card release is expected at any moment. And finally, the exam date is tentative, supposed to be in the January 17, with February 2026 May the result being out. So, sir, we need to qualify FMG, we need to prepare. What should we prepare and how should we prepare? Absolutely, my dear. If you're an FMG aspirant, the first thing that comes to your mind, sir, environment like a content, a mock test, which will actually be similar to what is going to come in FMG, right? We should have an example. So, first of all, admit card download, that's very easy. You need to go to this website, go to the FMG examination, log in with your credentials, and download the admit card. And easily you'll be able to download your admit card in these 4 steps. These are very, very critical. So why this mock patterns? First of all those 2 sessions consisting of 150 MCQs, total 300 MCQs, you'll get here. It will test your clinical application, how good at you are at solving clinical cases or case-based scenarios. They give you that there's a 52-year-old man who is been suffering from a little central pain. He is consuming a particular drug and suffering from less frequency of stools along with a respiratory collapse. Identify the drug. So you should know that it is a morphine, which is a central analgesic, opioid analgesic acting on the mu receptors, and having a respiratory depression as well as a constipative activity. Correct? It has a lot of other concomitant effects like pinpoint pupil and so many other different effects, which can be reversed via naloxone. Because if there's overdose of morphine or any other agent, naloxone is an antagonist, right? So these kind of clinical based, case based questions whereby you will be having a real exam like interface correct subject weightage, FMG का actual level of difficulty, solutions plus explanations. Okay, just the solution is not given. Like I explained to you why morphine was the right answer. So with explanation, you can find this on our website, and you can see or try the free mock test. Now you need to press here, and the link is also given in the description box. So what about the syllabus? Can you just quickly brief us about the preclinical and paraclinical syllabus? Absolutely. Anatomy, physiology, complete structure and function of cardiovascular, respiratory or pulmonary, renal or kidney, right? Then nephro. Then you need to know about the blood system, hematology, complete lymphatic system, endocrine system, gastrointestinal, digestive, genitourinary, reproductive system, right? The different systems of your nervous system, right? Autonomic, peripheral, somatic, central nervous systems. So all the organs, right from your brain, spinal cord, mouth, esophagus, larynx, pharynx, trachea, bronchi, stomach, small intestine, large intestine, all the organs must be known to you. Biochemistry. You should know the biomolecules, carbohydrate, protein, lipids, vitamins, enzymes, the different biological molecules of your body, their classification, their basic function, their physiological role and metabolic reactions. Pharmacology, the most important pharmacology, different drugs, their classification, mechanism, adverse drug effects, drug interactions, pharmacokinetics and dynamics. Pathology, you should know the complete pathology and pathophysiology. Hirschman is one of the very, very fine book, right from your autopsy, necropsy, biopsy analysis to your staining, to your tissue, everything, right? Gram staining, Ziehl-Neelsen staining, endospore staining, microscopy, blood glucose, so many different identification, right? So many different tissue screening, cancers for different manifestations. Microbiology, you should know about the basics, causative microorganisms, those microorganisms causing which diseases, their symptoms, signs, their basic preventions, precautions, right? Their incubation periods, virulence factors and transmission factors. Forensic medicine, obviously I told you, thanatology, the stages of the death, sexual offenses. There are a lot of ethical, foreign, or I can say unlawful practices which are being carried out. So rape cases and all, in cases of some criminal crime, forensic medicine plays a very, very pivotal role. In the part of clinical, you should know the OBG, obstetrics and gynecology. Of course, that's very, very important during the pregnancy, obstetrics and gynecology as the complete reproductive. Ophthalmology and ear, nose, throat, the anatomy of eye, diseases of eye, glaucoma, myopia, hypermetropia, retinopathy, fundus screening, retinal imaging, basic things, cataract, ear, nose, throat, or otitis infection, sinusitis, correct? All the basic infections of the ENT. Community medicine, PSM, social and community medicine, preventive medicine is also one of the very, very vital subjects whereby you deal with different contagious, vulnerable diseases that spread through lot of, these are called as contagious disease, communicable or contagious diseases. So this could be the pediatrics, the special art of dealing with infants, neonates, surgery and allied subjects, whereby you learn about the basics of laparoscopy, abdominal surgical incision, tracheostomy, intubation, right? The different operations, catheters, decatheterization, right? Cannulation, drip, medicine and allied. Of course, the medicine and allied is one of the prime fields, one of the high weightage fields that you should know. So for each paper, there are part A and B, which carries 150 questions. There's no negative marking. So here is the subject-wise weightage. As I told you, medicine and allied has the most, 17%, followed by surgical and allied, which is 14%. Then we have anatomy, physiology. Then we have biochemistry. Then we have forensic medicine, 6%. Pharmacology, 6%. Microbiology having a good role, 4%. So this is a complete pie chart. Please do have a look at this pie chart of the FMG subject-wise weightage. This pie chart is very, very vital for you. So you need to visit the NBMS, National Board of Examination for Medical Sciences, regularly, and then practice for the same. So revise the volatile topics like pharmacology, biochemistry, microbiology, whereby we often get confused, and practice the MCQ, especially the clinical ones, daily. So do download this FMG, do download the app, do download the FMGE do give this mock test, and I hope that many of you qualify it with flying colors, and many of the questions do appear from the test as well. Hoping a great luck to all the medicos. This is Dr. Payam Vora signing off. Stay connected with Academically for more such amazing and interesting information.